First News with Keeler in the morning on WIBX and WIBX950.com.
So you talk about the long hauler symptoms that after a prolonged stay in the ICU, patient A, this is the person that they're tracking, had recovered and was ready to go home, but doctors found he was infected with a deadly drug-resistant fungus, Candida auris, or C. auris, discovered a little over a decade ago as one of the world's most feared hospital microbes. The bloodstream infection is the most frequently detected germ in critical care units around the world and has a mortality rate of 70%.
Oh, wow.
That sounds fun, doesn't it?
Mm-hmm.
Dr. Chmielewski is on the line right now. Doc, good morning.
Good morning to you, and happy post-Memorial Day.
Just talking about this, this is post-COVID, but this fungus that is a real killer, that they have no drugs to prevent the fungus from spreading. That's a little scary.
Well, it's one of many that we're constantly being afraid of. Vancomycin-resistant enterococcus, Clostridium difficile, pathogenic E. coli, and the list goes on and on and on. We've been really fortunate since the end of, before World War II, to have a lot of medications, especially the antibiotics, that have been able to help us and tide us over for at least 3/4 of a century.
Yeah.
And remember, one researcher was saying that we are really just about to go, or we are in the post-antibiotic era. And that's a scary thing. These different organisms have been out there before time immemorial or developed from other ones some centuries ago, and they're here with us, and they're a part of our planet.
And we don't have any way to combat them. That's the scary part.
Well, we don't, but we do. Normally when we think about combating, we think in terms of, especially drugs and surgery.
Yeah.
And, ever since the last couple of centuries with the development of surgery, and then in the 20th century, the development of different medications for all kinds of kidney disorders and heart problems, et cetera, we've really been blessed. But you have to understand, you do, that the immune system is the main thing that keeps us alive.
Right.
It's the innate factors that allow us to fight things. That's why I have patients come to me and they'll say, gosh, I have this and that. Why did I get sick? And my reply is, I think you have to ask yourself, why am I healthy so often?
Right. That's I guess you're looking at it as if the cup is half full as opposed to half empty. And is this what they call super germs? And hospitals have dealt with this, where these super germs get there's an outbreak and they have a very difficult time containing it.
Yes, they're we call them super bugs, or if you want to call them super germs for sure. And in most hospitals, or many hospitals, what happens is if there is an antibiotic that's going to be prescribed, it has to go through a pharmacy review on there to make sure that they've done the testing and that it is the appropriate antibiotic. So physicians have really clamped down on the use of antibiotics, which I think is welcomed by the osteopathic profession.
Yeah.
The other thing is, some years ago, the CDC, they sent out a brochure to doctors all across the United States, and they said, doctors, please, will you stop using all these antibiotics, except in areas where it's indicated? This is from the CDC years ago. And we know from studies that people who have ear infections and sinusitis and bronchitis and many other infections, stomach problems and so forth, they should not be treated with antibiotics unless you really know there is something there.
Right.
And the other thing is that if you do have things like an ear infection, a sinus, a sore throat, a bronchitis, or stomach problems or whatever, and even if you do identify bacteria, guess what? Your immune system, probably, depending on the source, 80 to 90% of the time will take care of it without the use of antibiotics.
I think what happens is because I've been in that situation where I've tried to get an antibiotic when I had a cold and it feels like it's a sinus infection, and the doctor doesn't want to give the antibiotic because they say there's really no evidence of it. You just have a bad cold, and the antibiotic will not help you.
Correct. In fact, I joke. I don't joke, actually, but the virus actually does a backstroke in a pool of antibiotics. But having said that, there have been studies where even if you do wait, if you know you have a bacterial infection, if you wait a few days or so, as long as you're not clinically deteriorating on there, it allows your immune system to be activated. And it's been shown that the antibody and the immune cell response is much better if you wait rather than right away hit the bacterial infection with an antibiotic.
All right, I want to ask about specifically what have you been seeing from patients who have Andrew has an interesting story on this with long hauler symptoms. Even people who didn't have a severe case of the virus are dealing with these symptoms that are lingering on. What have you seen specifically, and what success have you had in treating it?
It's interesting. The gamut of symptoms there really runs across the board, but the biggest symptoms from the top down, from the head down, let's say, are basically some confusion at times, but more an inattentiveness or inability to concentrate or finish a task, memory loss, depression, mood changes, and some anxiety or insomnia. And going down the list on there, people will have upper respiratory symptoms, where they have maybe a sore throat or sinus problems. But usually they will have an aberration in their ability to smell and taste. Where sometimes things will smell like ammonia or garbage. I just had a recent patient who has a difficult time finding anything to eat because everything just makes nauseated. And then because it's a multifactorial disease, the COVID can cause inflammation, or especially pericarditis and myocarditis. Most of the time, those things will resolve. And when we do EKGs in the office, we've seen occasional arrhythmias. They're usually minor. But really no cases of myocarditis, inflammation of the heart. And then, of course, in the lungs there, you have shortness of breath and difficulty breathing, what we call pleurisy. And sometimes the abdomen and the lower ribs, it'll bother them. And a minority of the patients will have some GI upset, like diarrhea especially. And then in the skin, people can have some different rashes. They call it COVID toes, or various blotchy rashes that come and go, or little white plaque areas in the mouth. And then, of course, kidney problems. So far, I haven't seen anything serious in terms of the kidney problems at all. But one of the things that I find interesting is the people that come to me, when you look at them, they are able to walk in. I have very few people that come in with a cane and difficulty with the disequilibrium and so forth. And the reason I'm bringing this up is that on the outside, unless they're actively coughing or slightly short of breath, you would almost minimize their symptoms and say, oh, you just had a virus, it'll go away. But these people are telling you that it's been a life-changing event. It just doesn't show on the outside.
How are you able to differentiate between the people who say are blaming whatever they're feeling right now on COVID, and maybe had there been no COVID, they still would have had the symptoms? So how do you figure out that it is related to COVID?
Well, I think you have to put on your Sherlock Holmes hat and take a look at everything and see. Like one patient I had, a lot of her symptoms really that related to things like fibromyalgia and depression really predated her diagnosis with COVID. And I'm talking about, pre-February 2020 or even if you want to go back of October 2019 in China. So you have to check that. But the other thing is when people come to us, aside from a complete physical exam and a history and checking their medications, we do some pretty extensive blood work to check for the different organ systems. And we do a chest X-ray and in the office we do EKG and look right there. And so from that and the symptoms and everything, you put it all together.
Yeah.
If it looks like a duck, sounds like a duck, it's probably a duck.
Probably a duck. Andrew, you're the person you ran into.
Yeah, so it was a friend of mine who was asking about, the Falcon Clinic, and I highly recommended it. And he said, I saw him on Friday morning, and he seemed very energetic, and he told me so. And he had been treated that morning, not expecting to be. And he said night and day difference, like a switch. He was no longer lethargic, tired, full of energy. So he was very satisfied, very happy.
What did you inject him with, Doc?
A lot of compassion and a lot of osteopathic treatment.
All right, and and that's that is the allowing the body to figure out that it can fix itself.
Right. It's interesting that with the long haulers there, a lot of studies are going on for all of these different symptoms of shortness of breath, and like I said, the brain fog and all this other stuff. And we like to put names on things because it does help us at times to direct the types of treatments that we have. But two things that come to mind are POTS and MCAS, postural orthostatic tachycardia syndrome, or POTS, where people can actually have their blood pressure drop some, and they can get some palpitations, shortness of breath, and weakness. That's seen in a number of people. And then the other thing is a theory has been touted, and I recently read an NIH paper in which you have MCAS, or mast cell activation syndrome. And these are mast cells, part of our initial defense system, that causes our mast cells to make histamine.
Yeah.
And, there are a number of things with that, including production of sputum and congestion in the nose and so forth. And so because of these things, people are talking about autonomic dysregulation or dysfunction. In fact, there is a syndrome there, autonomic dysfunction. The nice thing about the osteopathic approach is that we try to normalize those things by doing various things for lymphatic drainage and also our hands-on treatment of various nerve centers in the body. And I think that's where a lot of our success comes. We've been having people, especially with, let's say, brain fog. Andrew mentioned the energetics.
Yep.
When you get a backlog of lymphatic fluid in the brain, it kind of clogs up the system, and so you get changes of pH and oxygenation and all those chemicals that we learned about in chemistry. When you do these techniques on the head, and some of them are massaging techniques, some are stroking, some are tapping techniques, some are pumping techniques. They're called cranial techniques. And when you open up the valve, at least in the brain, what happens is you get the lymphatic fluids and venous fluids flowing again, kind of cleaning out the areas between the cells and the fluid there.
Yeah.
And people notice a big response just with that.
Before we let you go, Tom in Yorkville with a question. Tom, you're on with Dr. Chmielewski.
Doc, do you have any experience with Lyme disease?
Yes, I do.
Because a friend of mine this week, I was talking to his son. It's an 8-year battle with Lyme disease, and he is going through. COVID is like a hangover compared to this kid's gone through.
Wow.
Well, yes, I have seen Lyme disease. I have diagnosed Lyme disease. I have treated Lyme disease. Let me give you the medical party line. And this, again, is from CDC and a few other places, that there is no long-term infection with Lyme disease. And I kind of agree with that, other than the fact that there are clinics all over the United States that are touting this, and they're using all different kinds of things. I'm not being critical of them. What I'm saying is that I think, and this is my personal opinion, is that when people have Lyme disease, if they were appropriately treated, chances of them having lingering Lyme disease, I think, is more let me use a medical term, the discombobulation of their physiologic system. In other words, they're having lingering symptoms where the body has been deregulated or dysregulated. It's just not working right. And that, again, gets me back to the autonomic nervous system and approaches that we use. Now, having said that, I do keep an open mind on this because nothing is 100%. You guys have been talking on the Keeler Show about vaccinations, but they're not 100% either. They're anywhere from 70 to 95%, depending on one or two vaccinations or and so forth. But the same thing with Lyme disease. We have some pretty good antibiotics that can cure Lyme disease. But do some of them escape? They probably do. They probably do. But that doesn't mean that the immune system won't be involved in there. So I have a number of people who have these lingering symptoms there from post-Lyme disease, and they seem to do quite well with supplementation, other forms of therapy, sometimes even counseling, some antidepressants and all this other stuff. But again, I use osteopathic treatments in addition to medications, and I don't know, the people keep coming back for some reason. I hope it's because I'm helping them.
So Tom is, and the maybe they should reach out to the Falcon Clinic.
I will tell my friend.
Yeah.
But listen to him. He's been in this for 8 years, and he's like, it's like listening to a doctor the way he explains everything.
Right. What symptoms?
I will tell him.
What symptoms does the kid go through?
Oh my God, he's lost like 80 pounds. His stomach constantly hurts.
Yeah.
I mean, just about everything.
Yeah. Wow. Okay. So falconclinic.com, or they're located in Washington Mills. Tom, thank you.
Thanks.
All right.
Thank you.
That Lyme, I got to tell you that a lot of the ticks are carrying that Lyme disease. It is something to be worried about. I feel like, putting the off and that poison on your skin. Some will say, well, that stuff is dangerous. I think what you're preventing is a tick bite, which could be more dangerous, right?
Yes, and the other thing is just being bitten by a tick doesn't necessarily mean you're going to get Lyme disease,
right?
Because if I remember, it's only like 20% of the deer ticks. Not every tick, by the way. Ixodes, that's the species of the type of tick, and it's a little tiny, looks, oh my gosh, it's about the size of a sesame seed, for those of you who know what a sesame seed is, if you ever had a bagel. And that's in the unengorged state. But then when they do latch on and they have a blood meal from us, then they do get bigger quite a bit. But not like not like the dog ticks, and there are some other. There's a wolf tick and a few others, actually a bunch of them in New York State. The other thing is that if you've if there has not been a engorgement by the tick, and CDC is even saying that the tick needs to be on your system for 24 to 36 hours. I don't know how they ever got to that, because if I saw a tick, I would want it off immediately.
Yeah, pretty quickly.
But usually if there's been some exposure on there, one dose of an antibiotic may help, just to prevent if there's been exposure to the tick. But then there is at least a 3-day course of doxycycline, and then there are other, depending on how bad it is, IV antibiotics that can be used too.
All right. Doc, we appreciate your time. The Falcon Clinic is located in Washington Mills.
All right.
We appreciate your time today. Thank you.
Okay, thank you. You guys stay safe.
Yep, you do the same.